In this morning's Eye on Parenting, our experts answer your questions. You asked about everything from health and finances to the birds and the bees. And here to respond are early show contributors, Dr. Jennifer Hartstein, a child and adolescent psychologist, early show medical correspondent, Dr. Jennifer Ashton, and CBS News business and economics correspondent, Rebecca Jarvis. We have a lot to talk about.
Yes, we do.
I want to start with a question for you, Dr. Hartstein, and this one comes from a viewer in Los Angeles.
I have a 9-year-old daughter, and she's grilling us already about the talk. So she knows about the body parts, the menstrual cycle, pregnancy. She doesn't know the details. I'm hoping you might have a little insight on how we can make a decision on how to approach it.
That's a very important and very common question.
It is a very important and common question, and what she seems to know a lot about the basics. So you want to keep that conversation open and answer the questions that she's asking you. Mm-hmm. She's 9. It's an appropriate time to start that dialogue in an ongoing way.
Right.
Shouldn't be a single talk. It should be multiple times over however long she wants to ask. Let her lead the conversation, because I think the fact is the parents may think she wants to know one thing and she wants to know something else, so you want her to be able to be open.
Sure.
And the more open and honest you are with your kid at that time, and that your parenting can let them feel comfortable, the more and better prepared they are later. And I think it's a real important protective factor. Parents have to get over their own anxiety about that and really be open
Look how
to
nervous
talking.
Harry looks.
Right.
No, but this is very serious. You've written an entire book about
Right,
this.
Exactly.
And the other important thing, Harry, 9 might sound very young, but a recent study in the Journal of Pediatrics actually showed that girls as young as 7 years of age are starting breast development. So if their body starts to change, that's the time you need to start having that talk with them, as Jen was mentioning.
And it has to be ongoing.
It has to be ongoing. One time is not enough, because it changes as they get older, the things you're going to talk about, the questions they have.
Yeah.
And it's as serious as anything you're going to do in your time as a parent. We have a specific question for you, Dr. Ashton. This comes from our early show Facebook page. Stacy asks, what is safe to give my 1-year-old for a cold? This is a really good question.
Yeah, so important, Harry, especially at this time of year when a lot of colds are going around. Kids are back in school, they're doing sports. Recently in the news, we've heard a lot about the fact that over-the-counter cold medicines really can be dangerous in children under the age of 6. And the American Academy of Pediatrics is really trying to emphasize to parents, let the cold run its course. Most colds last 5 to 7 days.
Because as a parent, your instinct is, I have to respond to this in
Right,
some way.
right. And we're
the
not
best
saying
response in this
ignore
case
it.
is
Watchful
no
waiting,
response.
but there are some things you can do, because any parent of a child knows that when they are congested, not only are they miserable, but you're miserable. Saline drops, really safe. You can use a dropper spray. You can use a bulb suction to kind of pull that mucus and stuff out of their nose and make them feel a little better. It's important for them to be well hydrated, drink water, a lot of fluids. And lastly, bring them into the bathroom, humidifiers, definitely.
Steam.
Yeah, remember that?
Oh boy, do I ever. All right, Rebecca, this is we have a Skype question now. This comes from a viewer in Chicago. Rishi, are you with us? What's your question?
Yeah. We have 2 small children, and my question is, when should we start teaching them about being responsible for money and saving for the future?
And Rishi, it's a great question, and it's a question a lot of parents ask themselves, and the answer is it's never too early to start. But just like the medical responses that you've been hearing from both the Jennifers here this morning, it's about an ongoing conversation, not sitting down and having one conversation in life with your children, but constantly teaching them through how you behave yourself. And also, when you're at the grocery store, there are moments to teach them about the cost of things. Always a good idea also to set up bank accounts for your children and take them to the bank when you're setting it up, so they can see this is how it all works.
Money has to go in before money comes
That
out.
is right.
Oh, how crazy.
Thank you.
This is specifically for you, Dr. Hartstein, and you'll remember a week or so ago we had the story about the kids, the bullies on the school bus. There's a disabled child on the school bus. These kids are being bullied. The father gets on the bus, tries to do something about it, intervene in some way, shape, or form. And one of our viewers wrote us a note and said, how can a kid be expected to learn anything when they are scared, depressed, embarrassed, and abused? What advice do you give a parent in a situation like this?
It's a really, really tough situation. When we are so flooded with emotion, it's hard to let any information in at all, for adults or for kids, and especially for kids to regulate it. So it's important for parents and schools to work together at really figuring out what's happening, put in some anti-bullying programs, talk about violence, find those kids, because what happens is they're more prone to depression, more prone to anxiety, more prone to not going to school and really having school failure. So we really want to work with the schools, with the families, to talk about how to put in some protective programming, get them extra help outside of school if they need it, all of those things so that they can really participate the best they can.
That's a tough one. Dr. Ashton, back to you. This question comes from a mom from Dallas. Take a look.
How important is it to immunize your children, and what could happen if you don't?
Couldn't be more controversial.
Absolutely, but the CDC, Centers for Disease Control, is crystal clear, Harry. Immunizations save lives. We have to remember that 50, 100 years ago, people died of things like chickenpox and measles. We've heard recently about whooping cough outbreaks where infants are dying because they are being exposed by people who don't get revaccinated as adults. So understand it's a public health issue and it's an issue for your individual child. If you have questions or concerns, talk to their pediatrician. They are very accustomed to spacing out the scheduled immunizations and really talking parents through their concerns.
Jennifer, Rebecca, thank you all very, very much.